Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about laparoscopy. What is laparoscopy? Laparoscopy is the surgical procedure that is performed to examine the organs in the abdominal cavity or the organs in the pelvic cavity. Laparoscopy is a minimal invasive procedure that requires small incision. The instrument laparoscope is used by the surgeon as well as the long instruments or laparoscopic long instruments to visualize the abdominal or pelvic cavity. Why laparoscopy is performed? Laparoscopy is performed for diagnostic purposes. For people that are having abdominal or pelvic symptoms, tests like X-ray or ultrasound are done, but they are not giving a definite diagnosis. The surgeon will recommend laparoscopy to be done. Laparoscopy will be done to confirm the growth or tumors in the abdominal cavity or in the pelvic cavity. Infection can also be diagnosed by doing laparoscopy. Blockage, especially the blockage of the tubes, can also be diagnosed by doing laparoscopy. Unexplained bleeding can also be diagnosed by doing laparoscopy. There are some operations that can be done laparoscopically, and some of those operations are major operations. But if those operations are done laparoscopically, it's more of an advantage to the patient. Operations like cholecystectomy, which is the removal of the gallbladder, can be done laparoscopically. Hysterectomy, which is the removal of the uterus. Nephrectomy, which is the removal of the kidney. Prostatectomy, which is the removal of the prostate gland. Appendicectomy, which is the removal of the appendix. What are the advantages of laparoscopic surgery? 1. Shorter hospital stay. Some of these operations that I've just mentioned are major operations, but if they are done laparoscopically, you'll find that the patient is staying less time in the hospital compared to a major abdominal incision that can make the patient to stay longer in the hospital. Another advantage, less pain. Because the patient is having this small incision, the pain seems to be controlled. It's not going to take a lot of pain medication because the incisions are smaller compared to the bigger abdominal incision. Less infection. The organs are not exposed to outside compared to open surgery. Therefore, the infection will be there, but it's not going to be bad as if the patient had major open abdominal surgery. There are some operations that are done, and if they are done openly, you'll find that the patient needs to be off of work or not returning to normal activities for something like 6 weeks to 8 weeks. Whereas if the operation is done laparoscopically, you'll find that that patient return to normal activities within 2 to 3 weeks. There is so much advantages of laparoscopic surgery. Unfortunately, it has to be the surgeon who will decide which will be the method that he will be doing your operations. Even sometimes if you wish that the operation can be done laparoscopically, but the surgeon will always advise you whether it is going to be done laparoscopically or it's going to be done through open surgery. For today, I'm going to end here. If you like these short videos, please subscribe, comment, and share. Thank you for watching. Till next time. Stay safe and stay healthy.